Okay, the next part of our program is what we're calling the Mature 1p36 panel discussion. And these mothers, caregivers, saints in regular clothing have volunteered just to offer their insights and their words of wisdom. I have a number of questions prepared for them. But we are definitely going to open it up to what some of your questions would be. The thought here was that many of our children are much younger, and we don't really know what to expect in the future, with the caveat of the fact that each child is individual, so each person's journey will be different. But we wanted to get a little bit of insight about, perhaps for us with younger children, what's down the road for us. What can we learn from these wonderful women? So what I'm going to do is I'm going to have one active mic here, and I'm going to read some questions, but if at any point you have a specific question or you want to follow up on something that they're talking about, just raise your hands and I'll come out to you, okay? So, here I will give, just by way of introduction, we have Julie Carlson, and your child is?
My daughter is Brady. And she is 22, and so we're so happy to be here, and I'm like, I'd love to any questions and help with anything we can, and behaviors and living our dream.
This is Cindy Hoots.
I'm Cindy Hoots. I'm Callie Hoots' mom. Callie's 28, so really, any question, feel free. I think if there's something individualized that you want to talk directly with your child, any one of us will sit down and visit with you. Please feel free to come and visit with us one-on-one, because we would love that as well.
And I'm Christina Ferguson, and Molly Mendoza is my daughter. She's 24 years old. And you can ask us about when they learn to walk, when they learn to talk, and all that. But honestly, what you're really asking is, how the hell do you do this? That's what you really want to know, because it doesn't matter when my daughter learned to walk or talk. You're looking to see a little peek into your child's future. And looking at my kid isn't going to tell you anything about your kid. So, I mean, yeah, ask whatever you want, but I think that really you just want to know that you can do it, and I want to tell you that you can do it. Sometimes it's really overwhelming and you feel like, I can't do this, and I'm sick of people telling me that God only gives special children to special parents, because we all know that's baloney. There's plenty of people that can't cope and that crumble and turn to drug abuse or alcohol abuse or depression or anxiety, and it's hard, and that's why you need people. And if you look around, you guys have people. So lean on each other. And yeah, we're here for each other. And you're not alone. And you can do it.
I'm Julie Rivera, Johnny, 19. Huge fear of public speaking. So
let's give her some encouragement then.
I'm all... Woo! I am pretty much everything what they said. Open to questions. I know you guys have seen a little bit of crazy, and you're probably going to see a little bit more here because of this one. Please ask. We will sit with you. We love to talk about our kids and our crazy. And she's crazy. We love to answer questions. And like Christina said, those general, when did they walk, when did they talk, they are encouraging. Well, he doesn't talk, but they're encouraging to hear, because our kids are always learning. They're never, Johnny picked up a new sign in 5 minutes in the lobby yesterday. So that's, I think, one of my biggest things. Don't let them tell you they can't. They won't. Just, when your doctor says that, tell them to take it out of their vocabulary. It's just not cool. These kids are gonna do, they're gonna do a lot. They're gonna surprise you. They surprise me daily. He surprises me daily. So just ask away, because we wanna help, we wanna encourage, we wanna be there for everybody, like everybody's been there for us.
All right, great. So here's what I'm going to do. Mothers, I'm going to ask you to put the mic right close to your mouth because these mics are not that sensitive. So, exactly, like you're beatboxing. That's great. Okay. I'm going to kick off with the first question, I don't know if it's an easy one or an obvious one, but how is raising an older 1p36 child different from a small child? Any unexpected challenges or unexpected benefits?
Okay, the biggest, absolutely biggest difference is I can't pick Molly up and drag her out of Target when she has a tantrum. That's the biggest, the
That's gotta be
physical.
so sad.
And that it's maybe a little more awkward giving her a bath than giving a toddler a bath, or, and it's not as cute when they're old. When they're little and disabled, people give you that, oh, she's so cute look. When they're older, you get a lot of, oh, I'm so sorry, that must be so hard. And whatever, I just smile and, my other one's hard too.
She was
just
cute.
Yeah, she was cute. I don't know what happened. I cut off her red hair and now I get pity instead of.
She's still cute. Come on.
Yeah.
Other folks.
Ditto. Stop.
Yeah.
I noticed a lot of difference. Like the kids now are so small, and getting therapy, and I can see a big difference from when we started because, like, my daughter wasn't diagnosed till 10, so we had 10 years of looking, and so I can see like movers and shakers, which we didn't do anything. So we've had a lot of milestones, different ones. Brady has a lot of health issues, and so that always keeps us. And I know that has a lot of behaviors, and I know. Honestly, to me, today the conference, my whole thing is behaviors. Those are very challenging, and sometimes it's like to find that one thing that clicks to me is very hard, and I know we're all different, but sometimes I'm like, that's what I'm like, want to talk about. If there's one little thing, sometimes it can help for one person, and it might seem so minute, but it can save it. And it was like when something, or like you see your kid and it clicks in their head, it's like, to me it's like, all right. Or I'm always like, change lanes, or it's like you say, hey, we're getting bigger and stronger, and our kids are strong no matter if they're little. And when you have a meltdown, and I used to be able to pick up Brady, but I said I can't do that anymore either. And I'm thinking, but it's also, they're still our kids, and they still, whether she might sometimes be 3 years old and she's 22, it's all, there's love and there's frustration, but it just keeps swimming.
Any unexpected benefits? Any unexpected upsides of having a mature 1p36 child?
Well, she's still with us, so that's enough.
Yes, she's still okay.
You know what? One thing I wanted to point out was that people are getting diagnosed very early. I mean, even like before they even have the kid, they know. And I think in a way, we had an advantage. Molly wasn't diagnosed until she was 8. Callie was 6, 10, and 9. So for the first 8 years, I knew there was an undiagnosed genetic disorder. But for whatever reason, it never occurred to me that she wouldn't walk or talk. It never, I don't even know, I don't know if I just was naive, but it never occurred to me. Yeah, it just never occurred to me that that was a possibility. So unfortunately, now they're being diagnosed early, which is good, but then they're handed these medical journals full of really bleak stories, and then they think, well, my kid's not going to learn to walk or talk or feed themselves, or they're going to be riddled with seizures. And I think a lot of parents kind of in the back of their head give up. I mean, they still try, but I think they have that voice in the back of their head that says, she's probably not going to walk. Which for some, maybe that's true. But I think that the fact that we have older children, that our children were born before there was all this testing, it was kind of a blessing that we weren't burdened with those medical journals.
Yeah.
To tell us, it's not going to happen. Do you want to talk? Or are you still scared?
Julie?
Just to add on, we went through, just like Christina said, we weren't diagnosed until almost 9. So we did the open heart surgery. We did the bracing. We did the ear tubes. We did the eye surgeries. by the time we got diagnosis, health was stable. So we were treating things individually. We had seen OT, PT. For instance, he didn't learn to walk until he was 5, unassisted. I think that if I had seen 500 of the quote-unquote exact same kid walking at 2 and 3, I would have kind of backed down in my mind, saying, oh, well, maybe this just isn't going to happen. And so we pushed through individually, not having a name. Even when we got a name, they didn't know anything. They knew nothing. She called, she said, he has 1p36.36 deletion. We'll mail you what we have. And I was at work that day, Googled a bunch of medical garbage that I had no idea what they were saying. 2 days later, I get a packet from the hospital, our children's hospital. It's the exact same stuff that I already found. There was nothing. There was no information. So in those senses, and also to add on to the older kind of unexpected, your stuff shifts. When they're younger, it's kind of more the toddler, like, you have to do their clothing for them. You have to, move their legs and do this. So like as he's gotten older, those challenges shift. He can now help get himself dressed, but I'm making peanut butter and jelly instead of throwing formula in a bottle. So in those situations for us, and then obviously for Johnny, the behavior has increased and intensified because he's stronger than the Hulk now. But things shift, and you shift with it, is how it works. You adjust and you keep moving. So people on the outside are looking in and they're going, wow, that's really hard, or that's really bad. But you've shifted, so you don't really feel how bad that is because you've grown with it. It's like adjusting to your new glasses. You just kind of grow with it, so you don't realize until you take them off, oh crap, I can't see anymore. And that's kind of how I feel with him. It's just, it is what it is, and you move forward. You love him. I love him. How do you do it? You do it. He's my son. I love him. Why wouldn't I do it? Until the day comes when I physically can't do it, why wouldn't I do it? He's my world. That's what I want to do. I want to watch him grow and learn how to sign chicken. And, that's what you want. So.
All right. Yeah.
I also wanted to say, some of you were talking about how traumatic the diagnosis was, receiving it, and we were talking about, we were like, yes, we were celebrating. We were totally celebrating.
Well, at least we had an answer. I remember when we got it, we had an answer.
It was such a relief to have a diagnosis, because until then it was, undiagnosed genetic disorder, what's that? Honestly, we called it Molly syndrome. And if I didn't feel like explaining it to somebody, I'd just say, oh, she has autism. I knew she didn't have autism, but a stranger doesn't need to know my life story. I don't know them anything.
Molly syndrome actually sounds pretty good.
Yeah, Molly syndrome. So we called it that for years.
Change it.
So anyway.
Okay.
Real quick, back to like the diagnosis when you were saying, hey, I know when we were looking and we checked all these different, at first I was like, there's got to be somebody else like there, because I had all these lists of stuff that she was doing, and I'm thinking, honestly, I wanted to see if there was an answer. One geneticist, he was doing a talk, and he says, you know what, if you don't have a name for what your child has, then you don't put a lid on it, and you don't put a top on it, and you don't think that they're not going to do certain things. And I thought, that was the greatest feeling, because I thought, good, I don't need a name or a number. And then a year later, after we checked to George, Prader-Willi, all these chromosomes, and they came back and they said, hey, number 1 chromosome. I said, Brady, number 1 screwed up. All right. And she's like, I'm number 1. And I'm like, you are right. So, hey, we're happy for our diagnosis.
Okay. So, no, that's great. And because, and we've said this several times, me and Ken have had these conversations, the book is not written on your child, right? Just because they have a designation doesn't mean you have a destiny, okay? So let's just remember that, okay? Yes.
That's a really good way to put that.
Amen. That's going to be a bumper sticker someday. Okay, what has been the hardest part of this experience? And then what have you found either most easiest or most fun?
Well, I think we all know Molly's had some pretty challenging behaviors, like really violent behaviors. Like you're afraid CPS is going to come because the neighbors called the police. Like head through lead glass windows, trying to jump out of the car on the freeway as I grab her by her ponytail with the door open on the freeway and her seatbelt off. Stripping down naked in the mall at 16. Red Robin, walking in the lobby and seeing Johnny and dropping and tearing off her clothes and throwing him at him. And she's had some really challenging behaviors. So that's like the emotional part of that. Like you can deal with you think you can't, but you can deal with the day-to-day behaviors. But it's the emotions of the day in and day out, not knowing, is this the rest of my life or is this going to stop next week? Like the uncertainty.
The uncertainty.
And walking on eggshells. Like all her triggers, avoiding all her triggers was exhausting. And I think finally people have asked, like, how have you gotten her to turn around her behaviors? I quit walking on eggshells. And if she sees a trigger, we pretty much put it in her face and force her to deal with it. And it kind of has desensitized her. So she throws a fit in Target. She knows now we don't leave Target until you're quiet and all of us are done shopping. And so there's been plenty of times where we're in Target and she's throwing a fit. And of course I look like a neglectful mother because I'm just letting my adult act like a toddler, throwing a fit, laying on the ground, kicking and screaming. And I'm ignoring her, literally not even eye contact. And I know people think I'm crazy at Target, but now we can go to Target and she can shop like a young lady. And, you know, and I think you've all seen such a huge improvement compared to
Yeah, very much so.
San Antonio. For those of you that don't know, we went to San Antonio. She would not leave her room. And when she did, it was violent. We went to the dining room and somebody brought us food. She picked up the cutlery and chucked it across the dining room.
It wasn't very good food, I'll just tell you that.
Well, maybe that's what it was.
In fact, I was going to do that myself.
No, it was really violent, scary behaviors. Not anymore.
Yeah. You know what? Let me just follow up really quickly. I want to come back to this question, but I wanted to ask you guys, because this is something I know we experience, but I ignore, is other people's reaction to my child when we're in public. You know what I'm saying?
I don't care.
Right? Either they're acting out in public, or other children coming up to call it and going, "What's wrong with him?" You know, and all that kind of stuff. Me, I look at it differently than Amanda does, but I'm wondering, what do you guys use to cope with that? Or do you?
You know what? I laugh at everything, so
Yeah.
I can say that probably what I use is humor. But like Ellie has asked me, "Mommy, doesn't it bother you when people stare at us everywhere we go? Everybody turns and looks." No. If I walked in the room, if I saw me and Molly and two grown women holding hands and they both have flaming red hair, I'd look. But I think I grew up with flaming red hair and two really tall brothers with flaming red hair. So I grew up, every time we walked in the room, everyone would kind of look at us. Are they triplets? Because we all looked exactly alike. So I think I kind of grew up with people looking. Mm-hmm. And so it didn't bother me. But one thing that I do so Molly doesn't feel like it's about her, like that it's bad that people are staring at her. When we're in the grocery store and people are staring at her or looking at her funny or whatever, it usually happens when you're in line and you have nothing to do. We're standing there and people will be like, watching her. And Molly's chatting away. I'll say, "Molly, it looks like somebody wants to be," and I say it loud so everyone around us can hear. "Molly, It looks like somebody wants to be your friend, but they're too shy to say hi. Why don't you say hi?" And it kind of calls out that person, like puts them on the spot.
Yeah.
Yeah, but it puts them on the spot, like you're staring at her. She's a person. If you want to know something about her, say hi. And then, in my head, I'm thinking, I don't know, they may be staring because their brother looks just like her, and they're wondering, oh, that looks like,
that could be my brother. Yeah.
Do they have the same syndrome? Do they,
Yeah, because you really don't know, yeah?
And to add on to that, I'm trying to figure out a way to make just a little business card size business card saying, in Johnny, my name is Johnny. I have 1p36 deletion. I'm awesome, but sometimes I like to hurt myself. if you would like more information. And then I'm going to list our website. Something that, because we do have people that come up to us in our community, they work really hard in putting our SPED kids out there. They do a lot of out and about, and it's not just his program, a lot of our programs. So we still get ugly, and because we have ugly, we get some really crazy, crazy looks. But I'm finding more and more people are now offering, can I help you? Can I do something? And it's as simple as somebody saying that and me saying, yes, please put a chair in the middle of the room, like when we're in a waiting room. So I can get them off the floor, get them into a safe place, and just that little change can snap me out of so that I'm able to snap him out quicker. But then afterwards, they'll ask, what's going on with him? Or, so I'm thinking something like that would be real easy to just hand out. If they don't ever look at the website, sweet. If they crumple it up and throw it away, what have you. But if one person reads it and one person changes, they're going to be better to the next special ed kid that they see. So in that sense, I think that we don't only owe our one child, our 1P community, we kind of owe it to all of special ed, all of our special kids that we see, to keep advocating and putting them out there and exposing them to the different things that our children do. None of our kids are the same. Some are just nonverbal, some are STEMmy, and STEMmy scares people, and I'm like, oh, STEM away, STEM, so I think the more awareness that we're bringing out into the community, the better place it's going to be for our youngins. It's going to be for the generation that comes after our kids, and it's going to be for our grown kids. STEM away. As they grow up, it's going to be easier, and then they're not going to be afraid of going into the community as much either, because they are human. They do know when people stare at them. They do get that, because Johnny will mad dog people, so we do a lot of that. Johnny, say hi. And the shy kids will turn away and they'll run. And the other ones will come up and be like, oh my gosh, I like his wheelchair. There's so many reasons for people to stare at us, and they're not all bad, but we live on the defense. So we're ready to fight instead of educate sometimes, especially in a bad moment. And I have to change my mindset a lot. I have to work really, really, really hard to change my mindset and make sure that I'm not attacking people for being curious. Now the ugly ones, they get a whole different, they get a different kind of card. But I think it's important in that sense.
So moral of the story is educate first, mad dog later. Okay.
That's
all right.
it.
I think that's great. Cindy, this next one's for you. Nicely said. If you had the chance to talk to yourself 15 years ago, any advice that you would give yourself 15, 20 years ago, maybe? What advice would you give?
My advice to myself would be quit worrying. We got this. Quit stressing. Things are going to turn out fine.
Yeah.
She went through milestone after milestone, just like every child. They reach milestones. Maybe it's a lot later than typical, but there were milestones. Celebrate those milestones. Post them on Facebook. Share them with the world.
Yeah.
Because these things will help. But my advice was don't be so hard on yourself.
Nice. Okay. And I'm going to ask just a couple of more questions, and I'm going to turn it over to you guys to ask these guys some questions. Okay, I'm going to ask the question that is sensitive, touchy, and but the one that keeps me up at night. Okay, so if this is my little disclaimer, if I offend anybody, I just don't care at this point. How did you manage puberty with your child? I mean, How? Yeah, I don't know. I got a boy. It's gonna be hard.
It is really scary before you get to that point.
Okay.
It is very scary thinking this is coming if you've got a young lady that you're raising. When it got there, once you get past it, it's no big deal. You put way more anxiety into it before it gets there than after you get to that point. Does that help?
We celebrated it because we laugh at everything. And so when Molly started her period when she was 8.
Wow.
And yeah, but
Super.
nope, she was a lady. So we were going to have a lady lunch. And we gave her like tampons, not tampons, but pads and deodorant and shower gel, like lady pampery things, and made a big deal about it that she was a lady. And then we went to Disneyland and she told everybody she was a lady and that she was changing her name to Maxie. And so for years, every time she had her period and I'd call her Molly, she would say, "Call me Maxie." So everybody knew when she had her period because her name was Maxie.
Oh my God.
And it was fine. She dealt with it fine. There was a time when it was really like medically, that it was just really heavy to deal with.
Yeah.
And then she
Yeah.
got on the pill to kind of regulate it. And then the pill caused a lot of anxiety. I mean, but I think those were like medical issues, not, oh crap, how do I deal with puberty issues?
Yeah.
It wasn't nearly as gross as I thought it would be because you don't even want to deal with your own period, and now you're dealing with another grown woman's period.
I'll take your word for it.
Yeah.
Okay.
You don't want to.
Okay.
So, but it was not. Yeah, he said he's real. I'm an open book. I don't. Well,
Okay.
there's some stories that I probably shouldn't tell. I'll tell in private. But
Yeah. Our time is limited.
it's gross, but it's gross the same way poop is gross. You know, it's not like it's any different than any other bodily function. You know.
Right.
It was-
Yeah.
yeah.
I don't think there's any fluid I haven't dealt with yet.
Yeah.
So I want to hear from both
But you want to
Julies
hear
as
from
well.
the boy.
I really do. We'll get back to you later, other Julie.
For us, in terms of hormones, he's raging. I can't remember when puberty started. I just remember giving him a bath one day, and I was like, "Oh crap, there's a hair there," and I'm like, "What do I?" And I'm thinking something fell somewhere, and I was like, "Oh no, please, no." He's strong. He's always been strong. His upper body is crazy. So for us, that testosterone has helped increase the anger and the raging. He is now at an age where they say it's supposed to be leveling out between 18 and 20 in males. We don't really work anywhere close to the norm, if you haven't noticed. So I'm not sure where they're at. It's not something that I've bothered to be like, I don't even know if you can blood test it, but it's not something I've bothered to do. I avoid pokes, even though he loves shots. But anything that I can avoid, we just don't bother. More so because I don't like getting in the car with him. For us, though, that's been the biggest thing. And then we're recording, sorry. Last summer, he found himself. If I need to elaborate, I'm not. That's been a bit interesting, but again, natural, go to your room, took to it, end of story. But that is something that I hadn't thought of. Being a single mom coming from a home of all girls, I hadn't thought of that. And I was like, oh God. And poor Jason, our BCBA was Jason Marshall, who spoke here yesterday. And I was like, I'm sorry to do this to you, but I have no males in my life that are like, that know Johnny enough to answer this question. What do I do? What? But he's amazing, and he was like, we're just gonna do this. We're gonna tell him he's gonna go to his room, and it worked. But that is, it is in the future, sorry, boy parents. But other than that, I haven't really, we don't have to deal with menstruation, and for that, I'm like, hallelujah.
Okay, so there's an upside. There is an upside. Okay, that's good.
But I think boy-wise, in our home, that's what we've had when it came to puberty. So
Okay, so themes I'm hearing so far are don't freak out about it. It's natural and it's going to happen, and there's people who can help you with this. Julie, and there's what? And there's answers.
Lots of answers.
And there's us, right? Right?
Yeah. And
Julie Carls.
I just wanted to say on Brady regarding periods and stuff, we had a whole different issue. She started her period, and with her heart problems, we couldn't do the pill because it was blowing up heart pressure, and we were waiting for a valve. In the midst of this, we were dropping clots huge. So at 12 years old, I was gonna get her a hysterectomy because I was like, we can't deal with this. It's not gonna work. And our doctor was like, oh my gosh, I've never done a hysterectomy on somebody so young. And I'm like, well, I'm realistic, and we're not gonna live with this. And you know what I mean? But what do we do with her? Because we couldn't do anything, medicine, all of that, and couldn't live with that. Well, in the midst of that, it's right when the ablation was coming out. And she said, could we try this first? It's very invasive, but it will take care of things. And I'll tell you what, it was the best thing because we started about 11. Yeah, it was 11 and 12 because I was 12 years old. And so, and with that, they put an IUD in, and we have not had a period since. We don't have anything. So we do have hormones, which they can go, and then watch out for the full moon. But other than that, we had to do that for her periods because we couldn't, we were going in for medical, and it was just so, that's something that could happen too. But anybody with ablation, you know, it's like she's not going to be having any children. And it was the best, one of the best decisions that I've done, or that could happen.
Okay, we're going to go out to the audience for some questions.
On this topic, did any of the schools have issues with the girls when they were on their periods? Did they just handle it, like changing diapers?
Oh, yes.
Oh, your school did have an issue?
Oh, lots. Yes, that was.
Did they make you keep her home?
That was one of the things that they used against her to keep her out of regular classes. It was ugly. So it was a management issue of each time, each month, and we ended up working things out with the nurse. So supplies were with the nurse in the nurse's office, and that's where she would go each time. And Callie, I hope you're okay with me sharing this, because I know it's real personal, but it's helping a lot of other families. Okay.
Did you have to write it into the IEP?
I refused to allow them to put that into the IEP, or refused to allow them to discuss it in our IEP meeting. When they would bring it up to try to keep her out of regular classes and they were using it against her, I started asking each of the women in the room, would you please tell me, when is your monthly cycle? Are you heavy or are you light, and what products? And they were incensed that I would want to discuss that in front of their male colleagues. No, you're asking me to discuss what's going on in my child. Let's hear yours as well. Share your story. Well, it kind of shut things down. So, okay, I know it's the way we address things, but I will be happy to discuss these issues, but not in the IEP meeting. So maybe that's the wrong approach, but I felt this was a medical issue that we could solve in the nurse's office. I worked individually, one-on-one with people at the school to make the accommodations without writing that into the IEP documents. Now, other people may feel differently, and it may be necessary in your situation. I'm not saying that that's the answer, but it did come up. So,
Molly was in a self-contained class, and so there were aides, and usually she was drawn to the male aides that would be the ones that would work with her, but they always kind of traded off and let the females take her to the bathroom, and we never had any issues. Molly was fine with it. When Maxie showed up, then Maxie was fine with it.
On the same subject, from the child's perspective, how did your daughters respond when it first came?
We talked about it a lot, and I would be open about, I've got mine, I've got, months before, because we knew that she was developing breast buds. I mean, like I said, she was 8, and I think she was wearing a bra at probably 5 or 6. So we knew it was coming early. And so we would just talk about it like as if it was any other daily event. Oh, mommy's got her period. I'll be right back. I got to go change my maxi. You know, like it was not a big deal. So when she got hers, it was like, time to change my maxi. And one thing that will like cognitively how to cope with, if is it time to change it, is I just ask her, is it mostly white or mostly red when she comes out of the bathroom? Because she does need help changing she's potty trained, she can use the bathroom independently, but she does need help changing her pads. Mostly because she just doesn't care and will just grab that sucker like, you know, she's not delicate with it. So I help her change it. And I just, when she comes out of the bathroom, I'll say, oh, you know, was it mostly white or mostly red? And so if she says mostly red, I'll say, okay, get back in there. You know, and just treat it like it's not a big deal. It's not a big deal, really. It's, you know, whatever. It's only once a month. Well, sometimes it's more, but then it's a medical issue.
I was just curious, 2 questions. One, did you see, is it something that kind of like ours where you can just kind of track it so you know when it's coming, or was it more inconsistent? And 2, what options did they give you as far as, I know someone had talked about like doing a shot or that kind of thing. What kind of options are there did they give you for that?
Molly's pretty regular now, and there's apps even. There's period tracker, or you can just mark it on the calendar, and she's pretty regular. But I think this community especially, you become really in tune with your child. So even if you're not tracking, I don't have to go and count. I know just from how she's acting and how I'm feeling, you know, 3 females in the house, you know, I know I'm a week ahead of her. You know, so I know it's almost her turn, and you just kind of become in tune with her, and you kind of know based on her. Now, when she was younger and it was really irregular and she was having the really, really heavy ones, that's when she got on the pill. And of course, then she was on the, where she took it for 3 months and then off a week and then 3 months. And of course, those, you know, they show up on time because it's regulated.
So our daughters are a lot like all women. They are just like all women. So all of them are going to be different. So it's not an easy question for us to answer. I know obesity plays a role in regularity. It could go months with nothing, and then once it starts, it could go 45 days straight. So the one thing I would recommend is talk to your own gynecologist and get their advice on how to manage any of those kinds of issues, just like you would for yourself. But there are a lot of options now. The patch, the ortho patch, you can use that continuous, put a new one on each week, and you can go months on that and never have a period. So that's an option. What she was talking about, if you have questions about individual things that we've talked to our doctors about, I'd love to visit with you about, but each of our daughters are different in how they're going to go through this, just like all the different women in this room. So
I just thought, usually when you get on the pill, all of us, because your doctor is your gatekeeper, he's got to look at your vagina before he can give you a pill. No, I just wanted to assure you that they don't do a pelvic exam or pap smear and stuff, but they can do an ultrasound to find out if there's any irregularities. And Molly does have a uterine fibroid, so she does have cramps and pain and a lot of clotting, but it's not so severe that, I mean, I think those are medical issues and not like, oh my God, my period's here and Maxie's here. It's more of medical stuff that we deal with.
So I know, like, whenever it comes time for women, like, that they get extra moody. So whenever it comes time for our 1Pers, is it like an increase in behavioral issues really bad? And if so, is birth control a really good option for that?
For Molly, it wasn't, because the birth control increased her anxiety and that triggered more behavioral issues. But being on the pill for, it was probably 6 to 8 months that it was enough time to regulate her. And then when she got off, her periods were normal. But yeah, they're moody, and full moons too.
Yeah, hormones affect all of us, and our children are no different. But the procedure that she was talking about is where they go in and they basically cauterize the inside of the uterus with extremely hot water, and it's more like an outpatient procedure. I mean, they're not going to feel any of that. But then after that, they either have no period at all or it's extremely light. Now, you're still going to have hormones. You're still going to go through those things. But if you think about, we all need hormones. So it may be just something that you have to manage through other means. So each person's individual, and that would be a good thing to talk to a gynecologist about.
So speaking of hormones, is there any way of regulating them? So I'm thinking, especially with my son, he's already a handful, and I'm thinking, as the hormones rage in him, is there anything that you guys have experienced in terms of regulating them, either through medication or other means? And I know we have some medical professionals here that could probably speak to that.
We have not. Yeah, no, I don't think any of us have addressed that. It's more the day-to-day maintenance of everything else that you're doing. I don't know that any of us have done any hormone therapy or anything like that.
Dr. Hopkins, would you know anything about that, or is that something you can address?
So for the girls, there are lots of options now. It almost seems like you can pick how often you want to have a period and deal with it, and that can be from never to regular monthly cycles. There really are a number of options, and they have a lot of different doses of hormones, and you can do estrogen only or estrogen and progesterone or surgical procedures. It depends on the needs of that particular individual. And that includes both their emotional aspects and behaviors as well as the medical issues. So there's a lot of options there. For the boys, there's not a lot of options. If they are deficient in testosterone, there are ways of dealing with that. There are ways of suppressing testosterone production. So if you had somebody who was being very violent or doing self-abusive behaviors that were thought to be driven by the hormones, there are some ways of dealing with that, but they're very rarely used for the boys. So it's more something that you use medication and behavioral management issues for most of the behavioral part of it.
Okay, hormones and menstruation, although really interesting subjects. I'm sure. Okay, I got one back here, I got one right up here, and I got actually one right here as well. So,
I don't know how to word it right, but do you feel like with the 1p36, like the more high functioning, is it worth, because you talked about like getting a hysterectomy or whatever, is it worth keeping the uterus and stuff? Because would they even, for the high functioning ones, would they even understand how to raise a baby and stuff to keep all of, you know what I mean? So what would be the point of?
As a boy mom, totally different, but the same. Unnecessary surgery is not something I would ever consider putting him through. We wait years to get his teeth cleaned. Sedation is no joke. As he's gotten older, it has gotten harder and harder for him to come out of. Elective surgery like that, for no medical reason, in my eyes, I would never do it to him. Obviously, we're not having a hysterectomy. I can't speak to our kids having kids, but to me, those situations are, if at all, few, and very far between. I think that just in that sense, again, elective surgeries, because so many of our kids have gone through surgeries to save their lives. And those scare the living bejesus out of us. Surgeries like just setting a set of tubes scares the crap out of me. He went through a 10-hour open heart surgery. Getting a dental procedure that's 30 minutes long, and I'm literally in the room next to him. I was a mess last summer because as he gets older, it seems to get harder for me. I put off everything and we try to cram it all into one, and even for testing, because now at this age, a lot of testing needs to be done under sedation. He needs an MRI, you have to sedate him. We were lucky one time, we had him getting ready to go through the whole thing, and she was like, let's just try the gas first before we do anything else and see if we can get away with it. Most children's hospitals are very accommodating in that sense. She said, I'm gonna gown you, you go stand next to the MRI machine, and we were able to get it. Anything that I can do to avoid surgery, to avoid sedation, I'm on it. Again, it doesn't completely answer your question. We're not gonna be having a hysterectomy, but for the sake of making life easy, that wouldn't be an option for me.
You have to keep in mind that that's a major surgery, and there's less invasive ways of dealing with those issues. But I think basically what you were asking is, can they be a parent? Is what you were asking, is am I going to be a grandma? And I think, honestly, statistically speaking, they're going to have, even the children that are the least affected by the syndrome are going to have enough challenges caring for themselves. I'm not going to say it's impossible, but I honestly can't imagine an adult having a child. Now, I used to work with adults with disabilities, and I did have a couple of clients that had children, but they were very I hate the term high functioning, because really, what is that? I mean, people say, oh, Molly's so high functioning. And I'm like, she's 24 functioning at the level of a 4-year-old. That's not high functioning. But yeah, because it's all relative. But so somebody that's less affected by their disability, even they needed a lot of support from their community and their family and caseworker involvement and stuff, just to make sure that that child was safe. So I mean, I don't know how much your child is affected, but probably it would be best if they didn't, you know. I don't know. But as far as a hysterectomy, that's major surgery, and there's other ways to deal with the inconvenience of menstruation than a hysterectomy.
Okay, let me reframe. Oh, when I was saying history, okay, at our time when this was happening, and I don't mean to be over the top, Brady was we couldn't do any pills, we couldn't do shots because it was blowing up her blood pressure, and she was getting anemic, and she was going through 3 pads an hour where she was getting anemic, and she was dropping clots out were this big, and I am not exaggerating. And she was like, oh, mama. And I'm thinking, and we tried, and I thought that was the only option we had. They did not have the ablation then. This is 12 years ago. So at that time, and with her heart, we already have heart problems, and I was at the only options, and it was like, and it wouldn't stop. And we're at school, and I'm like, we're anemic, and I'm like, and we're in the emergency room how many times? And that was my only solution, because I was like, it's not going to get better, it's changing, and it was not healthy for her personally, and my daughter, and she was not large then, she was very small, so just over so many years she keeps gaining weight, so she was a very tiny girl then, but it's still, so the weight didn't have anything to do with it, but we couldn't get anything regulated, and I was like, you know, and she was walking, but it was affecting her health and her heart, and so that's why, and at that time it was drastic, but we needed it, and the ablation is very invasive, and for surgery, we have a lot of surgeries, but I would only do things that we need to do, and that was quality and quantity and her health, so that's how we had to pick that.
So it's a very individualized situation, and you're going to make those decisions based on what those facts are at that time and what the procedures are that are available or other options. So I hope that happens. Can this adult that has 1p36 get pregnant? Absolutely.
I have a behavioral question, actually. Have any of your kids actually grown out of their behaviors, or has all been because of redirection?
I can say for us, yes. And we had very early on intervention, but I also want to stress each child is different. So I'm going to let Christina answer.
I think the behaviors just change. You know, maybe grow out of. I don't know if is really a proper description. Like, I don't know. I'm trying to think of maybe one of Molly's old behaviors that were annoying. But say we got rid of that one, and it was usually replaced by another one. But not. It's not like she purposely said, like, oh, well, I can't do that anymore. Let me do this. It wasn't like a replacement behavior. It was just as she matured. You know, I don't know. She's not into Disney videos anymore. Her focus had shifted, and now, and her ability to cope with stress and anxiety and sensory issues maybe matured too. So in that sense, she outgrew them because her ability to cope with the world around her grew.
I think it's also important when saying behaviors, there's all different realms. We live in the world of SIBs, self-injurious behaviors. Me biting my lip is a behavior. If a BCBA would be looking at me right now saying, why do you keep tucking your hair back? Why do you keep biting your lip? Tapping a pencil, tapping your foot, those are behaviors. Stimming, it's a behavior. So depending on what you're looking to change or eliminate, for us, again, stimming, stim away. Socially awkward, yeah, so what? It's giving him the input that he needs. I would prefer him to shake his arms and his legs and tap, even though the majority of Johnny's stimming looks just like his behaviors on a different intensity level. Obviously, far more than him hitting himself. We have children that solely attack other people. That's a different type of behavior. If there's something that you're looking to change or reduce or eliminate, early intervention is key. Taking the time to speak to the proper people and implementing a behavior plan is key with these children. Had I had somebody in my life, our life, when Johnny was younger, who knows where we would be now? We didn't start with Jason. We've been with him for 4 years. We have made significant progress, although some of you don't see that. Things have been a lot crazier, and we're actually in the middle of like a 3-month downslide. Behaviors go up and down for us, even with everything steady, but there is such a consistency that needs to happen when dealing with certain types of behaviors. Just like Christina said, something's gonna slow down, but something else might come in and take their place, because along with the lack of communication and the frustration, they learn different ways, but things become habit. Okay, it's working. Things become a habit and they become easy. Communication, we haven't touched on that. I don't know, he hasn't wanted to watch speakers. Communication is key, guys. If you have a nonverbal child, I'm pretty sure the majority of us do, get them communicating. Sign, vocal, PECs, icons, AAC. There's a million different resources. You hopefully have good SLPs. You have us. I am a huge communication advocate because I saw what it did for Johnny's frustration levels. Talk to me, PM me, text me, call me, remember the time difference, because wherever you guys are, it's 6 a.m. at my house. But I think that behavior is a relative term. It takes a lot of consistency. Things can eliminate, things can increase and decrease in intensity. So like with Johnny, we're at this point looking for a decrease in intensity, and then we can get back to going from 5 meltdowns a day to 2 meltdowns a day to maybe every other day we don't have I call them episodes or issues. But again, behaviors present differently, but a lot of our children's behaviors come from those lack of communication, the lack of frustration, not lack of, giant frustrations. And so things can change and things do get better and things ebb and flow. It's just something that, again, I grow with him, I change with him. Good behavior services are not just going to say, stop him from hitting. A good behavior service is going to come in and tell you, I have to modify my behavior to expect him to modify his. Everybody around him needs to modify their behavior if we expect him to modify his. You can't say, Johnny, don't hit, bam, I'm gonna slap your hand because you just slapped that kid. Don't hit though. So there's a lot involved, and because it all presents differently, there's a million different solutions. So getting the right professionals in your life at a young age and saying, I'm going to be dedicated to doing this, because what happens is it affects his quality of life. Because I have to hover over him, he now doesn't get to enjoy his friends and family. I don't get to enjoy our friends and family as much. He's fallen behind in school because we have to make behavior number one priority instead of learning to make his own peanut butter and jelly sandwich. So get it when they're young. Get them when they're young. If you see something that's concerning, find somebody, ask, demand, beg, plead, cry. One of those is going to work at some point. Somebody's going to give in and be like, oh, I'm so sick of hearing her. Let's just give her an hour a week. You take that hour a week and you soak it in and you apply it everywhere. And you teach it to everyone.
All right. All right. Let's... I've just taken the clap every time Julie says anything. Johnny's chiming in. Okay, how many people think that we could actually go on with this discussion for like 3 hours? Right? Yeah, absolutely. These guys have been great. Unfortunately, we've finished our hours. We have other speakers, but I want to thank our panel of mothers, caregivers, personal heroes for their insights, for their candidness, and for their bravery. So let's give them a big hand. And thank you very much to... Give Johnny a round of applause.
Hey, Johnny.
And Callie. And Brady. And Molly. Where's Molly? Oh, and Molly, she's somewhere. Oh, there she is, and Molly. Thank you for letting us talk about you guys.